The number of people that are having tattoos placed is climbing exponentially. But what is also climbing exponentially are the number of people coming into the office having them removed. What sounded like a great idea at one point, a few years later, at a different point in life, may not have sounded like such a great idea anymore. Years ago, we really had very little technology when it came to treating tattoos. It was one laser basically, and we used it for everyone. The results really weren't all that good. In recent years, we've seen an explosion in new technologies, and now we have lasers for green tattoos, different lasers for blue and red, etc. So it's very important for a patient, a consumer, to understand what their needs are. If they have a black and a green tattoo, well, there's not one laser that treats all of them equally well. So they want to seek care from a practitioner that has multiple technologies. Not only do we now have lasers that have different wavelengths, which are better for different skin types, but we now have new lasers that deliver energy much more quickly, and that is better for certain types of ink. So we have nanosecond technology, picosecond technology, Q-switch rubies, nanosecond alexandrite lasers. We have all these different technologies under our roof, so we can hone in on what our patients' needs are and treat them most efficiently and safely. When we look at a patient's tattoo, a patient often thinks that their tattoo is one color. It's black, or it's blue, or it's purple. Very often it's a combination of multiple colors, and this requires multiple lasers to remove that tattoo safely and effectively. So it's very, very important that a patient seek care from practitioners who own and utilize multiple laser technologies for tattoo removal. Because there really isn't one laser that's a one-size-fits-all for 99.9% of the tattoos. And during a course of treatment for tattoo removal, it's customary that we use multiple lasers. We may start off with a laser called the Alex Trivantage, and then transition to something called the RevLight, and then the Pico 4. By using these different technologies in combination, we're more effectively and more safely removing tattoos. The biggest change in recent years has been the release of what we call Picosecond Technology. And these are lasers that are delivering energy at a trillionth of a second. And with this quick pulse, it's delivering much less heat. So these lasers are much safer for patients that have darker skin, and they're much more effective with tattoos that are fading, where you just can't get the rest of the ink out. So it's very important that patients be good consumers and make sure that the doctors they're seeing for tattoo removal have multiple technologies. At our office in Reflections, we have a Q-switch ruby, a Q-switch alexandrite. We have 1064, 532, 755 nanometer wavelengths. We have picosecond devices that deliver energy very quickly. And with the combination of these devices, we're able to treat patients much more effectively and much more safely. It's very important that patients understand what the best technology required for their tattoo is. If it's a green tattoo, that's a wavelength of 755 or an alexandrite laser. If it's a black tattoo, it's a 1064. And if it's a red, it's a 532. So those are three different laser wavelengths. If you try to treat that tattoo that has red and black and green with a device that's not appropriate for those colors, we find that the complication rate goes up dramatically. So it's very critical that a patient understand what's the best technology for their specific needs. And those needs may be the color of the tattoo, the color of the skin, how faded that tattoo is, what kind of ink was used, and it's essential that a patient be a good consumer in the process. When patients come into the office, very often they've seen pictures of horrific outcomes from tattoo removal, scarring and loss of pigment. And they ask, well, why does that happen? The most common reason that happens is the use of the wrong technology for the application. For example, if a person has darker skin and has a green tattoo and one uses an alexandrite laser on them, they're going to lose pigmentation and they're going to get scarring. Patients often ask, well, how do I get the best result from tattoo removal? In other words, how do I clear the most amount of ink and decrease the risk of scarring? And the answer is using the right tattoo removal laser for the job. Each color requires a different laser And each skin type that a patient has, from light to dark, also influences what laser we can use safely. So there's not one size fits all. There's not one laser that can be used safely and effectively for all patients and all tattoo colors. And that's the key to being a good consumer, understanding what your needs are and making sure you're seeking care from a practitioner that has those right devices for your needs.